Here we have non-contrast CT brain in 35-year-old female with history of ongoing headache who is on anticoagulation for recurrent pulmonary thromboembolism. On the first look, there is no evidence of acute intracranial hemorrhage, but when we look carefully, we can see asymmetry of the right and left side of the hemicranium. In the left posterior aspect of the hemicranium in the supratentorial region, there is complete loss of sulci and gyri, and there is a well-defined concavo-convex hypodense area involving the left parieto-occipital region. So these findings are consistent with subacute subdural hemorrhage, especially in the clinical context of patient being on anticoagulation. This can be very easily missed because it is isodense to the adjacent brain. This can also be very easily missed during on-calls when the on-calls are very busy. Hence, it is extremely important to remember these kind of patients where the findings can be subtle and the main abnormality would be effacement of the sulci and gyri compared to the other cerebral hemisphere. So hence it is important to look for symmetry of the cerebral hemispheres, not to miss isodense subdural or extradural hemorrhage.